Hello, my name is Alan. I'm a scientist and I'm the founder of Clear Sky Genomics. When the Berlin Wall fell, I was almost 3 years old and I was living in a small town in regional Australia called Lake Koroiba. When I was 3, I wanted to be a Teenage Mutant Ninja Turtle. I don't think I'm doing a very good job at being a teenager, a ninja, or a turtle. All around the globe, governments are investing billions of dollars into clinical genomics. This is fantastic because by studying the information in your DNA, we can produce better diagnoses, better treatments, and we can get a better understanding of things like cancer. This support for clinical genomics has the potential to transform healthcare for millions of people. In Australia, some estimates say that clinical genomics can help more than 10 million people. The thing is that there is so much data in our DNA, and there are so many differences that make each one of us unique, that most doctors are completely overwhelmed by this information. In fact, in Australia, there are less than 500 specialists that can do this. 500 specialists for 10 million people. If we want to realize the full potential of clinical genomics, if we want the people we care about to get the best standard of care, then we need to help more doctors use this information. We need something like an MRI or a CT scan, something a doctor can hold up to the light and easily see where the issue is. We need the X-ray for your DNA. And that's what led me to leave my job as a researcher and found a startup. I took advantage of the support for innovation. I found like-minded people who believed in the vision, and we got investment. And with this investment, we started building the X-ray for your DNA. Over the last 18 months, we've built a tool that helps clinicians understand a patient's DNA at the whole genome level, at the chromosome level, at the cytoband level, and at the level of individual genes. It gives clinicians the same information, it supports the same tests, it's just presented in a way that's more accessible. Now, this shouldn't be a novel or innovative idea, but from our conversations, it seems to be revolutionary. Our work isn't languishing in some paper hoping that someone's going to discover it. It is out there leading to new innovations. We completed a clinical pilot earlier this year, and we're finalizing a partnership with an American organization that will see us bring a solution to the reproductive health sector. We plan on using this as a foothold market and bring our tool to even more areas of health. If we want to realize the potential of clinical genomics, then we need to break down the wall of genetic complexity, and we need to help doctors better understand the information in their patient's DNA. In the last 15 years, we've done amazing, almost impossible things. We took something that used to cost millions of dollars and re-engineered it, so now it costs less than $1,000. We've learnt that in doing this amazing, almost impossible thing, we left people behind. We left doctors and patients behind. And if we want to realize the clinical potential of genomics, then we need to make genomics accessible for these groups. Society will benefit by seeing more doctors wanting to use genomics in their clinical practice. There are so many remaining questions in genomics, many of them surrounding variants of unknown significance. But what keeps me up at night is how that we can ensure the information in someone's DNA is used for the best interest of the patient.